Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have two amazing guests introduced to you now. Lori Calabrese, MD, is a psychiatrist in Connecticut and is also an expert in metabolic psychiatry using food as medicine to treat psychiatric conditions. She is a clinical advisor to Metabolic Mind and a lecturer for Nutrition Network in their newest course, Metabolism and the Mind, where she published the first case series in metabolic psychiatry describing complete remission of depression and anxiety using a ketogenic diet. Wow. She is the founder and medical director of Touchpoints 180, an innovative consultation service and treatment pathway using metabolic strategies for remission of psychiatric conditions and restoration of metabolic health. She specializes in comprehensive, state-of-the-art psychiatric evaluation and innovative psychiatric treatments of adults and adolescents in South Windsor, Connecticut, which is minutes from Hartford, and provides consultations globally regarding metabolic interventions for mental health and wellness. We are also joined by her colleague, Rachel Frase, RD, a registered dietitian and mental health expert who specializes in personalized ketogenic diets. As Lori says, and very truly, everyone needs a Rachel. Dr. Calabrese and Rachel Frase, what an absolute honor it is to welcome you both to Boundless Body.
Thank
That
you.
was too nice of her to say.
But it's also so true. We are like a fearsome duo, I would say, and love working together. And so I think what we do is really work together all day, every day, looking at how to, how to bring the best of metabolic health to patients who really want to be and get into great shape mentally, great shape emotionally, great shape physically, great shape metabolically. That's what we do.
It's amazing. Yeah, you said it on stage at the Symposium for Metabolic Health in San Diego, and you said it with such conviction. Everybody in the room believed that, yes, we all need a Rachel. So we're really grateful for you as well, Rachel. Sounds like you guys do amazing work together, which I can't wait to talk about. Before we do, I do want to talk about that Symposium for Metabolic Health. I've been able to talk to several people who were there, and I've been able to ask them, what are some of the standout moments? What were some of your favorite parts? And almost universally, the favorite part for everybody was that very first day where we spent an entire day talking about metabolic psychiatry. It was absolutely amazing. Lori, you were able to present on that day. Like, what an honor to be up there. I had not been as familiar with your work, and you calling out Rachel as well on stage. What was it like to do that presentation and be able to present that information to an audience that was absolutely just rapt? They were so focused on what your message was.
It was really wonderful. This was the first presentation of the data that we'd been working on and that Rachel and I had published. And we're actually so proud that we were able to publish it as first co-authors. So we really shared in it from the beginning to the end. And when Doug Reynolds reached out to me and said, would you like to really talk about what you're doing? I jumped at the opportunity not to just do a general overview, not to talk about psychiatry in general, but really to say, this is what's cutting edge. We actually have data. We can tell you, we can describe to you, we can show you exactly what it takes, food-wise, ratio-wise, keto-wise, movement-wise, lab-wise, to get depression and anxiety to go into remission. So it was very exciting to pull it together and really a thrill to be able to talk to other experts worldwide, people who dialed in, and really all of the families and people with lived experience in the audience who were seeing this information for the first time. Super thrilling.
Yeah. Rachel, was this your first low carbohydrate conference? And either way, whether it was or was not, what was your experience like? What were some of the highlights for you?
In terms of Low Carb USA, it was my second San Diego one, actually. And it was fantastic. And it was the same as the first year, where it's this great mix and intermingling of like regular lay people that this changed their life, like in whether it was diabetes or weight loss or just getting their quality of life back. And now the gamut is expanding. Just a great mix of regular people with amazing stories and doctors and researchers. And the speakers are so down to earth, just talking to everyone, reaching out to everyone. It's just a great community. It doesn't feel, I guess it feels like you're with family and friends and you're not like at this medical conference. So I'd say both years was the same. And I think that's probably how all the low carb conferences are.
Yeah. it's quite interesting. We were all kind of sitting on the same row, like 2 or 3 rows back, and I noticed you guys. I noticed you, Lori, obviously because you did the presentation and came up and said what a great job you did. And as I'm looking down the row, I'm looking at my friend Robin, who's sitting right next to me, who reversed her bipolar. Right next to her is Janet, who had some mental health difficulties in her own life and her family's life as well, and now she's doing some great work in that space. And you're right, it is such a wonderful mix of everybody in the space, the people doing the work, the clinicians, the researchers, and lay people that are still on their journey. And I don't think it's anywhere more obvious than when we get the questions. I made this point before that the line of questions that you get can come from such a diverse array of different people who are attending the conference. And I just have to say to both of you, I was so impressed by both of you. Every time I looked over, you guys were so dialed in on whoever the speaker was. You guys were taking pages and pages of notes. And Lori, you in particular, when you came up to ask questions, you asked amazing, very genuine questions in a really kind of like humble and learning way. Like, you're a doctor, you're doing all this work, yet you're also seeking more experience and knowledge out there. I was very, very impressed by the attitude that you guys came to that conference with. I don't think you missed a single minute. And again, just all the notes you were taking and the questions you were asking, I thought was absolutely wonderful. So I really picked up on that. And yeah, I just wanted to compliment you both on that.
Oh, thank you. Well, it's a real opportunity to be a learner in a conference setting like this because we both came to it thinking every single person here is someone that we can learn from. We can learn from their clinical experience. We can learn from what they're doing. We can learn from their exercise routines. We can learn from their experience with their family members. And the kind of dialogue that really made that possible wasn't just at the tables during the conference, it was in the hallways, it was in the bathroom, it was at the coffee stand, it was, when we
Very
went
true.
out for dinners, like we were all together all the time in the meeting rooms. The electricity was really evident. I couldn't be more effusive about a conference. I think it was the best conference that we attended this past year for that reason. Yeah.
Yeah, I agree. It was absolutely wonderful. You mentioned it happening in the bathroom last year. I literally bumped into Gary Taubes in the bathroom as I was coming up one of the stalls. Like, oh, hi, Gary Taubes. Great to see you. Pretty cool stuff. Yeah, it was an amazing one. I'm sad that I missed you last year, Rachel. Lori, I'm not sure if you were there as well. But yeah,
It was. Last year we had a poster. It was the first time that we were going to do a low carb presentation, and we presented a poster of different work. It was our first entree. And so it was a really lovely beginning. Ketogenic was there. The ketogenic textbook had just come out by Nutrition Network. There were wonderful vendors there. We made a ton of new friends
that's
in the
awesome.
entire low carb space. Yeah.
That's great. It's so fun to discover new people, thinking that, again, all of us attended that conference last year together and didn't get to bump into each other. And this year we did. So grateful to have met you guys. And yeah, every year you just meet more and more people. And it's so fun to see all this work unfolding. And I wanted to ask you, before we dive into some of your latest research and the work you do at Touchpoints 180, I wanted to know how each of you kind of got into this work. First of all, maybe like individually. And then secondly, also how you guys kind of came together to become this like wonderful team.
So maybe Rachel, you'll start. Why don't you start with that? Why don't you tell your story first?
Sure. I think personally, it was gut health, and it was over probably 15 years ago now. Professionally, it was about 8 years ago in the weight loss, diabetes space, type 1, type 2, just that general metabolic health space where I got a job opportunity and I took it. I wanted to get out of the traditional dietitian space, which I'm sure you've heard about in terms of, our education and the government guidelines and how all of that influence. So to have the freedom to practice like true therapeutic carbohydrate reduction with real people and see phenomenal results that I'd never seen was huge. And that really, launched where my career is now. And now, Lori, we met through serendipity, basically. Somebody knew us in common and, got us connected. Lori was looking for a dietitian, like, how can I, expand on this? And I'll, of course, let you talk more about that and your experience. But, and then, now since we've been working together a good couple of years now, it's been just another level of expansion. Like, now I'm still helping people with diabetes and weight loss and getting to a normal life, normal weight, quality of life, all of that. But it's also putting their anxiety into remission and depression and these conditions that they've had for maybe just new onset in the past year or chronic, like 10 years plus, that's just, really taken away from their life. And so it's just really been an honor and to be able to take it to another level that I didn't even know was possible with nutrition, right? And of course, now we're learning at all these conferences, we're learning day by day how much more there is to learn about our mitochondria, about like this underpinning of metabolic health and mental health. Maybe health is health, right? Like maybe there's this under layer where we can treat everything with diet and lifestyle in such a wonderfully powerful way.
That's amazing. Rachel, I do have one question about your own story. You mentioned being a registered
Sure.
dietitian and all of the challenges that come along with that. You mentioned the training. You're largely given kind of the dietary guidelines, which we know don't work very well. I got the same thing. I'm not a registered dietitian, but I'm a nutrition coach. And with my nutrition certification,
Sure.
they do the same thing. It's the same stuff. How were you able to break out of that? Because not many dietitians do. They kind of get stuck in this thing, but they've committed to it and it's kind of their career and they're stuck giving people advice that doesn't seem to be working. What was the kind of like time frame and that series of events that led you out of that?
Yeah, that's a great question. I think there's probably a lot of variables. I think the main one is probably my own health. Following a regular American diet, pretty healthy. My mother always cooked healthy, but having like these severe gut issues that just got worse and worse, and like, what's going on? And taking out grains and dairy and like those sorts of things first, and then getting down the rabbit hole of gut dysbiosis. And well, let's actually go low carb and ketogenic and take out everything, including fruit. And like, let's see. I can't tell you how my health just like it blossomed. Like I got rid of exercise induced asthma. Like now I'm such a better athlete than I was. I wish I found it in high school, right? I got rid of just so many things. Like my gut just transformed where I didn't have to like worry about abdominal pain and cramping and bowel issues and things that like anyone that's experienced knows that like, wow, you need to like know where you are or how far you're going, like where are you going to be, that sort of thing. Am I going to be away for a while? So I think just my own personal experiences, mental clarity, focus, just, yeah, I'd say that was the number one. And I guess in terms of my education, I really paid attention. And I think, dietitian's training gets a lot of negative talk, but in terms of the base of my education, I really paid attention in biochemistry, and I paid attention and, really learned about cholesterol, because we do actually learn that cholesterol is essential for the body. We learn everything about protein, how essential it is. Like we do learn about metabolic health. It's just not put to us that way. Like we learn about insulin resistance, but it's not put to us or focus on that much in a way where we can learn how to transform someone's life with it. It's just sort of like facts. And I think being able to really have the understanding of the science and be able to understand the biochemistry and all of that helped me just sort of not even like think twice about it, just like not even look back, not even think twice.
Wow, that's amazing. Thank you for sharing that. I appreciate that. Dr. Calabrese, how about yourself? How were you able to find some of this information?
I came to it late. I grew up in an Italian family making handmade pasta, right? And that's what we did. That's what we ate, and that's what I continued to do. And as I went into practice and practiced for years in traditional psychiatry, I started realizing after a while that I was no longer on the cutting edge. Nothing was new in psychiatry. And so I practiced and was treating patients and was busy all the time in the office. Um, and then suddenly woke up and said, wait a minute, I'm missing something. What is it that I'm missing? And I went back to the science beyond what was just in the psychiatric journals and started realizing, oh, there's all these other fields that I don't know anything about that aren't even being brought into the office. One of those back then, more than 8 years ago, was TMS. Another was ketamine. And so I started thinking, I need to learn about this. I need to learn the translational science about it. And I need to figure out how to bring it to patients now. And the power of that was just one of being able to offer things to people who weren't better with what we already had. They were doing everything. They were wonderful. But they weren't better. They were stuck. And so along that way, as I was working more and more in these different fields, I started writing blogs. And to write blogs, I realized, oh, I need to like go and look for material and I need to go and look for papers. I came across a really old paper, and it was a paper on using ketamine to put anorexia into remission. I'll make this a short story. Wrote the blog, let it go, wrote a bunch of blogs about a bunch of different things, and got a phone call a couple of years later from a woman who said, would you treat my niece? I'm an internist. She's been sick for 15 years. Nothing's made her better. You are the only doctor I've seen anywhere that's even mentioned this paper somewhere. Could you maybe do this treatment? We're thinking we could maybe put two things together. She's trying a ketogenic diet. And I said, that's perfect because we need to do something to get BDNF going. We need to do something to restore the health of the brain in anorexia. We need to get fats back into a brain that's like really malnourished. And ketamine then can kick it into gear and produce more and more dendritic sprouting. Let's see if that'll work. It did. So she came to see me for treatment. She had started a ketogenic diet, was sort of doing it, not really into it, kind of having trouble staying with it. Finally had done it for about a month. And when she came to me for treatment, after 3 treatments, she went into full remission. She called her mom and said, I'm not an anorexic anymore. And her aunt called me and said, she's not an anorexic anymore. And I said, no, no. Like I have never heard of this. Let's wait. Let's see. No, really, it's gone. Everything's gone. The obsessing, the fixation, the rumination, the brooding, the over and over and over. Her day is not run anymore by exercise, food, what's in her head. That turned out to be true. That was 6 years ago. 6 years ago. She went into remission and she just got better and better and better. And after this was before COVID, after that, her aunt called me and said, you know what? We should write this up. We have never seen this before. Like chronic enduring anorexia doesn't go into remission. Eating disorders don't go into remission. At that point, in the setting of the opioid crisis, anorexia was the lead killer among psychiatric disorders. It is the most lethal psychiatric disorder beyond or besides, I think, opioid-induced deaths still. So Caroline, who's publicly talked about this, so I can publicly talk about it, Caroline Beckwith, went into remission, stayed into remission. We wrote a paper. I feel like I came back from the dead. I came back from my like interest in academia from years ago when I was writing and sort of in hallowed halls and had gotten away from that to do clinical practice. We wrote a paper, we published it. And then in the midst of COVID, in the midst of craziness, we decided to actually run a clinical trial. And that's what we did. We got an IRB, we found a place, we set up a protocol, we ran several adult women through the exact same thing to try to figure out which pieces were important and would we get the same results. And the short answer was we did. And then brought in Guido Frank to really help us analyze the data because we started saying, we think we're seeing it, but we're a dietitian, we're an internist, I'm a clinician. Like, how do we understand the statistics? We think this is big. And he said, oh yeah, it's big. Oh yes, it's big. And we should run with this. So he, in fact, has taken that and now is doing a formal clinical trial just on that first part. And in the setting of all of that, I met Rachel and said to Rachel, you know what? This isn't just for eating disorders. We need to do this. We can do this because you know what? It stopped her depressive symptoms. It treated the obsessing. It reduced the anxiety. This is really a thing. And we should offer it as a treatment in a psychiatric context, helping people so that they do it well and don't get sick and lose weight if they need to and gain weight if they need to. Like, let's do this the right way with patients. And it was shortly, I think, after Brain Energy had come out, we were fired up about it. And that's when we started this collaborative practice and put together all of the different touch points that Casey, we made up. Okay, we made them up because they didn't exist anywhere in a place. And we started thinking, what are all the elements, right? So, when you said, when did you first come to Low Carb San Diego, the Society of Metabolic Health Practitioners. It was with that first little data where we said, hey, we're doing this. What are the factors that help psychiatric patients and people stick to a ketogenic diet? Because everybody says, oh, they're depressed. They're not going to do it. She's too anxious. She's not going to do it. He's manic. Are you kidding? He can't follow directions. And so we brought data, graphs, charts saying, you know what? We know what it takes. Here's all of our elements. Here's the one it takes. By percentage, by graph, by timeline, we know what it takes. And then we've spent the last 2 years doing it and turning out a number of refining it in a number of different ways to get it right for everybody based on what they walk in with. So that's what we do. We get it right. We get the symptoms to go down. We correlate it to the ketones. And if you remember from that talk, I probably spent too much time introducing the whole idea, but the highlight was the graphs. When you see symptoms go to zero graphically while the ketones like are there, it is incredibly powerful. And we were the first, I think, to show exactly how long it takes in real life for people who walk in with a host of things, not just one, little depression, little anxiety, a little bit of ADHD. What gets better when? We plotted it out for them in real time. I think that's why the paper is so something that caught on with such wildfire.
Yeah, that's amazing. Wow. Well, listeners of our show will be very happy that you mentioned Caroline. We just interviewed her. So
Oh,
the episode, when this drops, that episode will already be live. And I have reached out to the aunt as well, who's going to be on our show maybe in about a week after this show. So everybody will be quite familiar with that story, which is absolutely wonderful. I think it's so powerful. It's almost to me more powerful than like using metabolic therapies in things that in the beginning seem shocking, like bipolar or schizophrenia or Alzheimer's. I've seen Alzheimer's in remission with people objectively. Like that's one thing, and that can be hard to kind of wrap your head around, especially in the beginning. But the anorexia part for me is like that is stunning. And to see people who have been in this field for a long time, like yourself, like Guido Frank, they're not necessarily like low carb people to start with, and we're going to go prove that low carb is best. You're almost like backed into this because you're discovering that this makes a difference. And I always talk about Guido's presentation because it's like he shows the case and the person does weight restore, but it's also like the graph you're mentioning, the person's mental state is objectively getting better based on questionnaires that are validated in psychiatry. It's
that's right.
crazy.
That's right. Well, that's what we do. And if you find and look at obsessive compulsive disorder getting better, panic disorder stopping. What's so interesting is that nobody has worked out how long does it take for OCD to go into remission, really, from start to finish in real people, in the real world, in real life. What does it take? What's the ketone level? What's the degree of compliance? What does it really take? So real life work is different, obviously, than studies that are really carefully controlled. And so it's been exciting to really precisely look for that. Because Rachel, you want answers to that. I want answers to that. We figure out when somebody says, well, I'm a little bit better, but I thought I would be better by this time. We adjust it, right? Um, Rachel has all kinds of ways that we talk together, and then she dives in and says, let's get this better. Let's get the ketones where we think we need them to be. And we test it out and show them that it works. And those papers are in the works. One's been submitted already. So
Amazing.
we got more coming out.
Wow, that's
Yeah.
amazing. Rachel, what was it like to get into this field and see these kind of reversals, the remissions, whatever you want to call it, in some of these really complicated psychiatric conditions? This is like way beyond, controlling your weight, for example, on like a it's with somebody who is overweight. What has it been like to get into this world?
I know it makes that seem so minimal, and it's huge. It actually is huge when someone has obesity and they're able to like get to back to a normal normal weight, normal life. But you're right, it's been just wonderfully amazing. I feel so blessed to be in a position where I can help people make changes to their diet that literally result in such an improvement in their symptoms for really a variety of conditions. And I think they're all every story. I'm like just thinking about the stories. Everyone's story is so amazing. But I really think when we can help younger people, when this is actually like first line, front line, that is unbelievably transformative. When you can help someone not be on psychiatric medications for the rest of their life, and all of the side effects and the other things that come with that too.
You have to
That's
tell. You have to tell a little bit of this story then, because this is like one of Rachel and I share this pride and joy in a young man whose life really will be forever changed. So I'll let you give a snippet.
I think you should start it. I think you should
I think I
start
should
it
start it.
with the onset of it psychiatrically. Yes.
Okay, so very quick story. We know we've all heard heartbreaking stories where you hear about a teenager or a young person who gets suddenly very, very sick. This happened to someone who was 17, who was suddenly hospitalized after the quick onset of agitation, irritability, and wild outbursts, violent outbursts, diagnosed immediately with mania, or maybe psychosis, or maybe actually schizophrenia, or maybe it's one of these things where it was so complicated, the diagnosis was a little bit unclear, and he was immediately put on medicine in the hospital and sent home. And the parents said, "Oh gosh, he's drugged. He doesn't even look like himself. He doesn't even act like himself. Let's take the medicine down." And within a week or two, he's back in the hospital again. More medicine, more trials, more symptoms, horrible. Came out. And the next thing that the parents did was call us and say, "Would you treat someone who's 16?" Later, later he was 17. But when we started, he was 16. "Would you treat someone who's 16? We've been given this horrible diagnosis. Like, what could you do?" And we jumped in and said, "We'll try. We'll try." Because if we're right about what we're looking at mitochondrially, if we can translate the science of this, if we can calm down the inappropriate firing, if we can quiet the delusional thinking, if we can get it all gone, then we can taper maybe his medicines. Then maybe you won't be living with what the doctor said, because the doctor had told the parents, "Your son has a chronic mental illness. He will be on this medicine or medicines like it for life." Start making plans, because their plans for beautiful boy, brilliant kid, college, all went out the window in 1 month. So he came to see us, and he saw me and he saw Rachel. And you should jump in now, Rachel.
Sure, sure. So it was a big change, obviously, for an adolescent, to change from a typical higher carbohydrate diet to a ketogenic diet, right? And all whole foods, nothing quick on the go, except for things that you prep ahead of time. Was a huge change. And I think the standout for me, just in terms of what we had to do nutritionally, it was a lot of protein. So tall, like 6-7% body fat, good amount of protein, what he needed for growing, right? Meet those growing needs, athletic needs, like he's an active teen. And then the amount of fat that it took to increase the ratio, not even like super high ratios, right? We're talking 1.5 to 1, and then increasing it. But just a lot when protein's that high to like meet someone's energy needs, get the fat that they need. In terms of energy, but also in terms of, the thing that I don't think we talk about enough in terms of, we always talk about ketones, which are so amazing and powerful, but to have that amount of fat available to like repair cells, cell membranes, the cholesterol available is huge for the brain, right? I'm sure we've all heard the statistic that the brain is 60% fat by weight. So I think just having that available constantly is super helpful too. But his mother's reaction to the meal plan, what it looked like, the macronutrients, the 200 plus grams of fat, was like, "I don't think we can do this, or he can eat this much." And of course he could, and he did, and he loved the food, and they got super creative with it. And it was a
Well,
really
you
powerful
got
thing. But
super creative.
oh,
I'd have to say you got super creative, because the thing is, I would never, and I want to say it to you, Casey, so that your listeners hear this too. I would never have done this without a registered dietitian actually doing it. This is a growing boy who's tall, who's still got to make a lot of testosterone, who still needs to as he got super active, back into sports, back into life, there were constant adjustments along the way. So this is not for the faint of heart, and it's not for somebody to just wing it when you're thinking we want symptom control
Right.
and we want like really ideal nutrition. So it's not just like doing keto. It is absolutely nourishing brain body health in every single way. So I think, Rachel, you're a master at doing that. The family loved it. They loved the food. They loved seeing him. They loved this. And we started tapering meds. And in a year, 1 year from the time that all of this happened, I was a little nervous about doing this fast. So this is like my true confession because you don't do this in psychiatry. In 1 year, he not only got ketogenic, adhered to it, loved it, stayed with it, felt fantastic, got buff. All of a sudden, his friends start seeing him and they say, "Whoa, man, what are you doing? Like, you look fantastic." And he felt fantastic and the meds dropped to zero. He is he is off of everything. That whole idea of you will be on medicine for life, you have a psychotic illness, you have bipolarity that we saw. It went into remission and it has stayed in remission enough that the trajectory that he was supposed to be on never happened. Like it never happened. This is
Right.
the story of a kid who took like literally a right-hand turn. And went down a whole brand new road that he thought was not going to be available to him, that his family thought was never going to be available to him. It's amazing.
Adherence, compliance. You're
Yeah.
talking about a 17-year-old kid adhering to a strict diet. Now, we've kind of made this point already in this conversation. Like, can people stick with this? It's already a burden. They're already dealing with mental health issues. Rachel, I would be willing to bet that if you or you were dealing with gut issues much earlier than I were, but you already made the comment, like in high school, if I would have known about this, I would have loved this. I think I probably would have too. And I think I probably could have stuck
Mhm.
to it. If you told me that I wouldn't fall asleep every day in first period, if you told me that my hockey practices would be much better and I'd be able to build muscle much better, my mental clarity would be better, I'd get better grades, I think I probably would have complied to something like this. I can't say for sure. And I was, drowning in, skim milk and cold cereal and granola bars for my, growing up. But like, what do
Right.
you think about like the compliance? Like, do you think most teenagers like really not only can comply, but kind of want to comply?
I think yes. I think with the right supportive environment, especially at home and in the house, but I think yes, with all those motivations that you just mentioned, absolutely. And I think the food, like Lori, you were saying, like he loved it, the family loved it. Like you just have to um, see everything you can have because it's a lot and it does take a little bit of prep, especially if you're going to go to events and be places. Maybe you need to take MCT oil with you or have it before you go somewhere where you can't control the food, but there's strategies, there's tactics. And I think absolutely it's a game changer. And if someone could see the changes or just know the changes were there, because now that we're having these conversations about it, there's less of having to do it like you do it on your own, I do on my own. We're going to be speeding this up a bit because now it's like all of these people are doing it on their own and can see all of these things get better. And I like that you pointed out getting better grades, being a better student, because like absolutely just the quality of the diet and the getting off the sugar roller coaster and like increasing, oh my goodness, amount of mitochondria. There's so many things that will just help that.
I
But I
might have
think
actually. Oh, sorry. Go ahead.
No, thanks. No, I think there's also one other thing that we didn't mention, which is really being able to dial in to how kids learn. Casey, nobody that we know actually in clinical practice is really embracing adolescence in this yet because so many parents and physicians are worried that if you introduce something like this to an adolescent, they'll develop an eating disorder. How can you do this? Like they're going to get an eating disorder. And so I feel like well, we've got a great track record because we were the first to treat eating disorders with this. So in fact, we reversed eating disorders with it. So at least for us, that's not really an issue. But we didn't mention how adolescents learn. And I think it's really important dialing in to how to connect with kids, older adolescents, young adults, and figuring out what do they want? What is their final destination? What can we get them where they want to go? Their parents may have a goal of like, gee, I would like this to happen, but really understanding for a boy or a girl or a young adult, what do you want? Because if we know what you want and how fast you want to get there, we'll do it. We can adjust all these different parameters to get you where you want to go as fast as you want to get there. And if you want to get there fast, we're going to have to do some things, like in a little bit more of an aggressive way. And if you want to get there slow, like we'll pace it to you. So that's huge for families and for teens. And I think that really enhances adherence when they know that you know what you're doing, that you know what to do, and that you're going to do it with them. They know that we like live what we do too, because they see it, we do the walks and we do some other things. So like we're full disclosure, we're like living the lifestyle. We're not just
Right.
with that lifestyle. Yeah.
Oh, that's amazing. That's so cool. I do want to talk about the paper that you released, that you presented at the Symposium for Metabolic Health, also a case series with multiple cases, which I thought were wonderful. Tell us kind of the nexus, what you were trying to find out with that study, the case series, and also tell us, kind of jump ahead a little bit, but tell us about how many people have actually put eyes on this paper. It's quite hopeful to hear how many people, how popular this paper's gotten is amazing.
Okay, so do you want to jump in with that, Rachel, or should I?
You can
I'll just
go
jump
for it.
So
Yes.
we published a paper last spring. It is a case series, which means it's a story of 3 people that we chose from our practice. They were all about the same age, in their early 30s, and they all had a mix of anxiety, depression, and ADHD. They each had 5 different things. Actually, 5 different psychiatric diagnoses that they'd carried for a long time, and they'd each been in and out of treatment, and they were functioning in their lives, but not well. They were sick of being sick of being on meds, wanting to feel better. So in treatment and looking for new treatment. And we told their story. I'll get to that in a sec. But that story is so compelling that within 6 weeks of being published, it launched to the top 5% of more than 26 million research papers ever tracked by Altmetric online all over the world. It's a case series. It's not a massive study of 80,000 people. It's a story of 3. Top 5%, 26 million research reports. Even months later, we're still at the 97th percentile. That paper is made it to almost every continent. And in every country, you can go on and sort of look at the metrics. And I keep thinking, who's reading this? Like, who's reading this? So I went into the metrics to think, like, oh, maybe academicians all over are going to do studies. You know who was? At the beginning, 87% of our readers were individuals like you, like out there, people out there who really wanted to know this. Now, academicians see like randomized controlled studies as their ultimate, and meta-analysis, above that. But I think a lot of research gets sparked by the N of 1, by noticing, whoa, something caught our attention here. What's underneath it? What's beyond it? How do we explain it? So that's how it all took off. And Rachel, I'll let you jump in and talk about like what we wanted to show with the paper. I'll let you take that.
Sure. Well, we wanted to show everything, I guess all of the factors that you were talking about in the beginning, all of the factors that go into how to make it easy for someone to be compliant with it, adhere to it, right? Because it is an important piece, and through their entire life, right? Because a lot of people are going to work and they have events and they have family things, or there's always somebody bringing in the donuts and cookies at work. So there's all of these things around you all the time, and so to really be compliant with it is key to really keep the ketones in a consistent place for a period of time to get the most therapeutic benefit. So we want to show all those factors. And I think for me, I think the social and what the paper showed, not just for me, I'm just thinking about how wonderful our groups have been lately. They've just keep growing and how positive they are. Our groups, meaning our Zoom groups. So we run Zoom groups and walks, and of course our book club. And these things are, I think, really helpful in people making this a lifestyle change. So for our case series and all of our patients, the more of our touch points that they adhered to, that they came to, that they engaged in, just increased their ability to, follow the diet, get ketones up, be consistent with this, keep their ketone levels where we aim for them to be for those, those individual patients. And they really build a community and really love also hearing other people's stories, which just naturally happens when you're in a really, safe, everyone feels safe, right? It's a safe place where you can talk about things. And I've heard a lot of people say, wow, like I never told someone how I was afraid to like leave the house or how severe the OCD was, or and I did it and I felt like it was relieving and it was helpful. And so all of these positive things that are just sort of coming out, I think like through the treatment, through following the diet, being in ketosis, testing their ketones, like all of those things are really important. But this whole lifestyle piece and being able to take it with them. And I always say you learn the foundation of the diet and then do it for a period of time and then you can decide in your future how you do it. But learning that core and having that like support and community, I think just makes it transformational in an expedited timeline. So that's really what the case series showed, is that anxiety and depression were put into remission in a time period of between 7 to 12 weeks for these 3 patients who also had, right, a total of 5 comorbid conditions. And I believe all 3 of them had ADHD, was just a common overlapping one as well.
And they all had metabolic issues. They all had a lot of stuff and a lot of treatment resistance. But I think if I can jump in just for a second, what we wanted to answer was really simple. How long does it take to get well? What gets well first? Depression, anxiety, ADHD? Does it actually get well? Does it go into remission? Does it go away? Right? Or does it just like get better? So we really wanted to know, what does it take and what trouble do people run into along the way? And I feel like we saw it all, from the person who didn't want to do their labs to the one who like was, cheating and having trouble like getting into ketosis at the beginning, to someone who over-exercised in the middle and then we needed to make some adjustments. So I really wanted to say this is what real life is like. And it's doable, even with all these things, even with all of our imperfectness, right? It's doable. And it's doable even when you think you've done everything, because you haven't, if you haven't done this.
Wow. Well, okay. So I'm thinking about the case series, and I know there were multiple interventions that you can make, which again, that means we can't say this is the cause of something. That's not the point of this. These are stories. But and also, you mentioned this already, but you also presented with the pyramid that shows all the different, tiers of evidence and things that we can study and learn. And at the top is the randomized, or the meta-analyses of randomized controlled trials and all that stuff. But that doesn't mean we should ignore the studies, and these stories were really, really powerful. So can you guys share the people that you chose to be in this study and the things that they did?
Sure. I'll let you jump in first and then I'll finish up, Rachel. Why don't you go first?
Sure. So we chose 3 patients that were in a similar age range and had, like Lori said, weren't perfect at doing it. And I don't think some people are, some people do come in and they nail it, right? But I think the majority of people need like have these little hiccups, and of course that's totally normal, totally like adjustable as we go along. And I think I just lost the question. Laura, can you ask me where you wanted me to go?
No, I'll tell you. Well, I'll jump in, because you know what else? What I get asked a lot, or accused of a lot, is, Dr. Calabrese, you were cherry picking. You chose your best. You chose the ones that show it. You chose like people who are not average. And what I love to come back with and say is, oh no, we chose what we see. We see people of all ages, but we see messes, because by the time you get to be in your 30s and you've had a little depression, and then you have trauma, and then there's PTSD, and then you develop panic attacks, and then it all wipes you out and you just start getting depressed. People accumulate things along the way in difficult lives. So we wanted to look at 3 people who we had treated for at least 12 weeks. We had a deadline to meet. So, we didn't go out to look at, longer people, because we wanted it to be like, who have we seen in 12 weeks? And let's choose what we really see, which is not the ideal person with one thing. but it was 3 people roughly in their 30s. They all had weight to lose. They all had metabolic dysfunction. One had high blood pressure. One had binge eating disorder. They had a bunch of different things. And we wanted to see if there were some commonalities. So what we did was looked at their data first. And then it was like the data jumped out at us. And then we started thinking, oh, well, wait a minute, could we plot them getting better according to their ketones over time? Oh my gosh, nobody's done that with the ketone meters. Nobody's saying, what does it really take? We have this idea in medicine that therapeutic ketosis begins, or we define it as beta hydroxybutyrate levels greater than 0.5 millimoles per liter. Guess what? Doesn't cut it when you're talking about putting depression into remission. So we were on a journey to figure out, gee, we're going to ask for compliance that's better than that. We think we are going to want ketones in this range. We think we're going to want a GKI like this. Let's see if we can work with people to get there, and let's see if that gives us consistent outcomes. We're exploring this. And so we published the first paper looking at what do we want? We want an average of at least 0.8. Our best results depend on how complicated the anxiety is, whether there's psychosis, like not our best results, but our ratios depend a lot on how much it is that we're trying to put into remission. And I feel really excited to be figuring that out. And we can do it on the ground without asking for a $300,000 study, because we just describe that to the patients that we see. We know we can tell them, this is what we've seen so far. These are the results we've had so far. This is what we're targeting for you. Let's work on it together, and we'll adjust it as we go, because our goal for you is to get you where you want to be, which is not in our office, which is like out in your life doing other fun things. So
Yeah. Rachel, as the registered dietitian, what was your role in the case series that was presented? What were you trying to help them with?
So getting the ratio right, from the start, I calculate their ratio and their macronutrient needs. So what's the amount of protein that they need to maintain muscle or gain? If someone does have that goal, of course, that's always taken into consideration. And we can absolutely do that with a ketogenic diet. So getting with their protein where it needs to be, and then the carbs as low as they need to be. And if insulin resistance is going on, they usually need to be pretty low to facilitate ketosis in a shorter period of time, meaning the adaptation phase and getting someone's metabolism creating and using ketones. We want that to be a short period of time, like a period of a few days or a couple weeks if it's needed, but not weeks and weeks, just so we can get them into a therapeutic state and see improvements sooner, of course. So calculating that and then putting it into food for them. So what does that look like in your day-to-day? How does that fit into your schedule, your routine with family meals, meals that everyone's going to like, so you're not making 2 different meals. So practicality and turning the numbers, right? Because it's a lot of math, the ratios and the macronutrients. I give them the numbers and what that looks like, and then we put it into real food and, portion sizes that are easy to like visualize and do. And some people will measure things, some people won't. It just depends. And measuring isn't necessary, but it can help if someone's unsure and they just want to be sure where it is. And then of course I follow them and I help them. We meet twice a week for at least the first month to look at where their ketone levels are and look at their meals, make any adjustments we need to adjust for, plan for anything, social wise, get more easy meals for them. And I also do the walk. So I'm at all the walks, and Lori always joins us on Saturday, which is fun, but we run 3 walks a week, and we're up to 4 Zoom groups a week. I do 3 of the Zoom groups. We have Leah, our metabolic educator, that runs our 4th Zoom group. So they see a lot of me. They see a lot of me because they're meeting with me twice a week. They're also meeting with me at the walks or in the Zoom groups if they come to those. So that's my main role, is just really helping them to understand, to learn, to see how this can be implemented into their life and how it can help them.
Yeah,
but I think there's another thing, Rachel, right? It's
Sure,
all of the interaction with the phone, right? The digital apps, photo journaling that we do. Like there's a lot of other little things where they know that, we're seeing their numbers, their ketones, their food,
Yeah,
right?
yeah. I
Yeah.
know that was a big component
I
of what you're
think
doing. Rachel,
Yeah.
I'm glad you mentioned the practicality of this, because that's kind of the fun thing and the endlessly challenging thing about nutrition is you've got the science and then you've got the practical. What is your family? What's your background? What do you like? What do you dislike? What
yes.
was on sale this week at the grocery store? You don't go to the grocery store and buy 180 grams of fat and 160 grams of protein. You buy a ribeye or like there's so many
Right.
different components. And so having you with all of those touch points to help them sort things out in real life, even down to things like, how are you going to make this? What do you have an air fryer? Do you know how to chop an onion? Like there's so many things that people don't know. And so the practicality of all of that, I think, is super important.
So
Definitely.
you should talk about what we're doing now, because we've seen this need, Casey, where really we are ketifying. Rachel is, not me.
Oh,
Rachel is ketifying favorite family recipes. We are figuring out, gee, in our area, a lot of people like to shop at a certain grocery store. So we'll give them the basics for their keto meals from X grocery store and then add this fat, add that fat. Like we go there and we've got like the shopping lists. So just being really practical, helping, giving recipes, finding adjusting things, all of that is part of, I think, this new kind of caregiving that is
mhm.
part of metabolic treatment. It's not like, here's your numbers, you're on your own, bye.
Right.
Like, we'll see you
Right.
next month. Yeah.
Yeah, totally. Okay, let's talk about the results of the case series before we get to what your current work is like. And obviously, you've already alluded to it, but what were the results like in the case series?
So the quick story is anxiety responds quickly and very fast, according to how quickly ketones are obtained. We saw complete remission of generalized anxiety disorder and one patient with OCD within 7 to 12 weeks. Everyone had depression, major depression that was at least moderately severe, resolve, meaning not depressed, meaning gone. And the nice thing about that case series is if you look at the graphs, if there were a couple of people who were on medicines there that were maintained throughout along the top, we were following ketones as we went and we saw stepwise progression and improvement. It was important for us to do lab monitoring because it's important for us to know if you can use the ketones that your body's making. And sometimes people coming into ketosis don't have strong red meat eating histories or ruminant histories. They don't have adequate carnitine. They can't actually shuttle ketones easily in and out of cells. And they need a lot of help transitioning to foods that will help them get the deepest nutrition, the best nutritional value. For what we were hoping they would achieve. So the quick story is complete remission of depression and anxiety in 7 to 12 weeks, as early as 7 weeks, as long as 12 weeks, and people who had had histories of years of medicine. They were in their 30s, and some of them had started having symptoms as teenagers.
It's so powerful.
So
If you had to choose one of the three to like share the actual like story, the background, that kind of thing. I know it's a bit like choosing your favorite child, I'm sure, but if you could choose one of the three, would you mind sharing an example of one of the stories of one of the participants?
do you want to take that, Rachel?
Sure, go ahead. No, you can go for it.
Um, yeah, um, let me start with a story that I think is really typical, which is someone who had been exercising along the way, and who started a ketogenic diet with us and was on a little bit of medicine as we go, and really was busy. So this person was busy. They couldn't get their labs done right away. They delayed on getting their labs done. And as they were getting into ketosis and as the symptoms were getting better, the improvement stalled and we started hearing, I'm tired, I'm tired, I'm tired. Why am I tired? We couldn't figure out, why is he tired? You shouldn't be tired. You should be energized. You should be great. When we finally said, listen, we think it's carnitine. We really want to make sure that you've got enough carnitine on board to get this all going and moving. And we finally said, listen, the baseline labs, we delayed getting them, go get them. We, in fact, found that there was an issue with having too low a serum carnitine level. We added a carnitine replacement within days. Energy improved, everything improved. Nothing changed with what we were saying, but the whole trajectory changed. So his brain energy changed, body energy changed, workouts got better, and all of a sudden, every other thing went to zero. So then the anxiety could go to zero, then the depression could go to zero. It was like it flipped a switch. And that's the kind of thing where it showed us that there really are things that we need to monitor. It's not just a press play and go thing, but you need to be like watching along the way and trying to figure out, is what he's telling us a bodily symptom, a mental symptom? Is he depressed? Was it a work stressor? Was it like, how do you tease it apart and pick it apart without, losing time and jump in and do something? So that was like a great little example of just the fact that we see this as a really interactive treatment, and a treatment that once you sort of iron out the pieces and get to remission, then you've got it's almost like teach a man to fish and then he can feed himself for life. Then he knows, or then she knows. But it's the getting there that is this collaborative thing that we do, that everybody on our team does, that patients appreciate.
Yeah. So if I'm remembering right, was this the case that the person was unemployed because of depression and actually got a job during the study that he was overqualified for? Or is that a different one?
No, that's a different one. That's the first one.
Okay.
Yeah. And actually job exceeded his expectations, both beyond training and everything else.
Wow.
That was a total, when we call it Touchpoints 180, he did a 180.
That's amazing.
Yeah.
Wow.
And
Okay.
and yeah, so the quick story about that, I'll give you like a little thing because Rachel remembers this, is this person said, remember how we were saying we can do it faster, we can do it slow with you. You tell us what pace you want to go. He said, just tell me. And Rachel and I had to talk about it, right, Rach? Because we were thinking like, really, like, what if he gets all this keto flu stuff? What if he's not compliant? What if he doesn't eat the salt? What if what if we blow this? But he was like perfect. And he hit ketones very high, very fast, and was like off to the races and did beautifully. And then got up, woke up, started looking for work, got a job, wife's in love with him again. It was all good.
That's incredible. Thank you for sharing that. I love hearing those individual stories. And just, it's like what our mutual friend Nicole Laurent says. Like, if you're sitting around waiting for randomized controlled trials, if you're waiting for the highest level of evidence, like, you're going to be waiting for a while. We're getting there. Like, we're on the way, and we'll have that, but it might not be that quick. And today, there are people that are suffering. And that's 3 people that you mentioned. And we often forget, that's not a very high level of evidence. It's only 3 people. It's a really small, subset of the population. Well, guess what? Those are 3 persons with families and friends and kids and all kinds of stuff that we forget, and they're suffering. And by doing something like this and presenting this at least as an option, at least let's try this and see if you can be compliant. Like, we need to do this like yesterday. Like, I absolutely love that work, and the paper's amazing. We'll be sure to link it. I do want to talk about the current practice, Touchpoints 180. Tell us about how you're working with people, what that actually looks like. It sounds like it's very interactive. I love the idea of going on walks. I think that's fabulous. And I think it's also like, I don't know how to say it. There's something like metaphysical about, not only are we talking about stuff, but we're moving in the same direction together, side by side, that feels a little bit more supportive to me than just like we're at the other end of a desk or something. You know what I mean?
Yeah, totally. Would you agree, Rachel?
Yes. Oh, yes, definitely. And it really shows, like you said earlier, Lori, that we walk the walk. We're not just saying go out for a walk or like, eat, eat ketogenically. Like, we're doing it because we know that it works, and we know how it's, transformed, been beneficial for us, of course. But when someone can see that, when a patient can see that you're not just saying, you're not I'm going to use the typical, right? When someone needs to make a change, the doctor says, move more, eat less, right? Exercise more, eat less. Like, that sort of typical advice that we've all heard. And there's no like sort of game plan or I'm right there with you. Yeah, I definitely think there is. I like that analogy, the walking with you, walking side by side. I didn't think about that, but absolutely, that's absolutely what it is, and I'm sure how it comes across to patients, because they know, they can really see how authentic we are and how we really are in the science, in the evidence, of course, contributing to it as well, but like nonstop staying up to date with everything and learning how we can keep individualizing, keep bringing the best science, the best treatment, and of course the practicality of it, to people. And hopefully this will become more of a normal, right? Like a normal thing. So you don't go and tell your friends, I'm doing this metabolic psychiatry program, or I'm doing a ketogenic diet for mental health, and they look at you like you have six heads. And they think, when are you going to stop this? I mean, a lot of patients have told me, when are you going to, said, my coworker, my friend said, asked me when I'm going to stop. I'm not going to stop. Like, I don't know how to break it to them, but like, I'm not going to stop because of like A, B, C, D, like my endurance is up. My gut is so much better than it ever was. My, my anxiety is just way down. I don't have panic attacks. I can go outside the house. I could keep going and going, but it's the movement is moving and on fire. And I just listened to your talk with Nicole Laurent, and that's like what you guys were talking about. What she was talking about was just how much momentum there is now on the research side and also the clinical side of doing it in practice and seeing the results and letting those results just show the potential there to everyone.
I think too,
So,
there's this community building that can happen in small groups. So that's what we saw when we were all at Low Carb San Diego together. You're sitting like right down the table from us, like all of a sudden you make friends, you build community. That happens with people who suddenly find themselves sharing their first name, they make friends with the group, and they realize that they're not so alone, and that other people's stories help them, and that their little recipe inspires someone else. It's actually so lovely, and it's changed my practice. Rachel's a lot younger than I am, but it's changed my practice entirely. I can't believe that I sort of like go out in yoga pants and tennis shoes, and my patients see me hanging around in like a polo shirt and yoga pants, walking in the woods. But they do, and it's just changed everything.
Yeah. Lori, this would be a great question to ask you then. Through your career, surely you have gone to many different conferences, right? All kinds of different topics in psychiatry. Probably a majority of them did not address nutrition at all. And you've gone to some low carb ones. How many lifetime friends have you made at other conferences that didn't really have anything to do with ketosis, ketogenesis, nutrition in general? Like, did you go to these other conferences and be on a first name basis with people that were attending? Or is that like vastly different in a low carbohydrate conference?
It's vastly different. In my entire career, before I started looking at and learning about the low carb world and going to all of the different conferences and meetings and the trainings that I've done now, and I can talk about that in a minute. I made one friend. He's still my friend. His name is David. And I met him in New York, 10 years ago. That's it. That's it. What everybody would go to a conference and sort of like learn. I would still do the same thing you saw me do there. I'd take notes, I'd learn, but there wasn't this incredible collaboration, camaraderie, connection during and after. And that's what is so striking about this community. I see it in my group at low carb. I see it among the SMHP. I've seen it with Metabolic Mind and the group that I'm involved there. And I've especially seen it in Nutrition Network, which is a whole other, wonderful kind of training and education that I'm involved in. So it's like, I don't want to use the word infectious. That's such a bad word, but it is infectious because it spreads like wildfire.
Yeah, that whole room, of people, like I've made this point many times that like everybody's ketogenic already, so everybody's energy is like super high,
so
and everybody's so kind and friendly, and it's that blend of people practicing and everyday people that's absolutely wonderful. Yeah, I'm glad you noticed that. Sorry you didn't make so many friends in the other conferences, but I'm glad you have a room full of friends at these ones. Yeah, why don't we conclude with you telling us a little bit about those trainings that you've been working on?
So I'll tell you a little bit about them. So the Society of Metabolic Health Practitioners has a whole array of opportunities available for people who want to learn more about metabolic health. Georgia Eat, as you know, offers a training program specific in psychiatry. Um, but Nutrition Network is the biggest international organization offering real science-based education and training at an exceedingly high level across the board for coaches, dietitians, nurses, naturopaths, people from other specialties, physicians, and physicians from all specialties. So I just completed their Nutrition Network Master Certification Program, and it was a group of 10 of us. I had to prepare for a year to even apply
Wow.
to like be accepted, and then I had to pass an entrance examination after that. So I did. But this last 4 months has been a whirlwind that feels like a PhD and a master's all wrapped in one, with 10 people from all over the world, readings, interactions, stuff, papers, writing, commenting on each other. We've never been so productive, so fertile, and so research-based. Looking at and answering questions. The whole idea is to really create a cadre of learning that goes beyond just quick answers, because there's a lot of undoing that we need to do in metabolic health. There is a lot of misinformation that's just been promulgated for decades based on inaccurate lipid heart hypotheses and other kinds of sciences that have just been accepted as status quo. So knowing what the real data is, where the numbers are, what the number needed to treat is for statins, what all of that is, I think is critical for all of us in psychiatry, in fitness, wherever we're coming from. It's not just that we have a right to inform our patients that metabolic psychiatry is available and that metabolic health is important. We have a duty to know the data ourselves. And so education makes that available to us. Getting the education gives it to us.
That's wonderful.
Yeah.
Well, I look at the two of you as just two wonderful human beings who are able to stay open-minded and understand that the science is not just what you were taught in school, that it is evolving and there's other things out there. And you were open-minded again, and embraced it, and are now doing such wonderful work, and presenting it and sharing it is absolutely wonderful. I know how busy both of you are. I can't believe we've already talked for over an hour. This is absolutely flown by. You guys are incredible, and I really, really, really appreciate all of your work and your time to come on our show today. Where would you like people to go to find you and connect with you and your work, not only just collectively, but also if you'd like individually, if you've got like social media, or where people can find you individually if they want to reach out?
Do you want to start, Rachel?
Sure, you can start. You can start with the website and everything.
So right now we're at lauriecalabreseamd.com, but we are launching our brand new website after the first of the year called Touchpoints180.org. And so touchpoints180.org is where we're going to have everything, including our clinical work, our programming, and our research, all under one umbrella. We're in South Windsor, Connecticut. We offer consultation beyond just our state, and really beyond the US. That we reached out a little bit beyond that as well. So that's where we are. Social media wise, I'm at Laurie Calabrese MD everywhere. And Rachel, I think you're at Rachel Frase, right?
No, it's actually my initials and then underscore nutrition. So RF at RF underscore nutrition on Instagram, X, same thing everywhere.
I will be sure to link all of that. I'll also link the new website, and I'll make sure to log on. This will drop at the end of, or I'm sorry, this will drop sometime after the site is live. So I'll be sure to link that as a live link as well. At the time of recording is not live, but we'll make sure we add that. Dr. Laurie Calabrese and Rachel Frase, again, just wonderful to have met you both in person. I can vouch for the audience. You guys are very kind and wonderful, very warm individuals that are very eager to share this message and learn as much as possible. And again, I know how busy you are. So thank you so very much for taking the time out of your very busy schedules to be on our show today and have a wonderful conversation. I think will help a lot of people. Thank you both so very, very much. We really appreciate you.
Thank you, Casey. Thank you so much.
Thank you. Thank you so much for having us and for all of your work and all the wonderful speakers you have on. And it's now one of my favorite podcasts. I'm so glad we met in San Diego.
Yeah,
that's very kind of you.
It was a destination. Yeah, it was a destination meeting.
Yeah, it definitely was. Well, thank you both so very much. I really appreciate you. And this has been another episode of Boundless Body Radio.